The Toxic Lady. On the morning of February 19th, 1994, 31-year-old Gloria Ramirez was brought to the emergency room at Riverside General Hospital in California. She was suffering from severe chest pain, extreme weakness, and restlessness, with symptoms indicating cardiac and respiratory failure. The emergency staff immediately transferred her to a gurney and began checking her vital signs. In those first moments, doctors and nurses noticed that Gloria's skin had taken on a grayish-purple hue, and a strange odor had filled the room. This peculiar smell caused the first nurse to collapse within minutes and experience mild seizures. Soon after, a second staff member suffered from severe weakness and muscle spasms before losing consciousness. Several other personnel in the room began experiencing dizziness and nausea. The emergency team struggled to stabilize Gloria's condition, but the situation was highly unusual and complex. At the same time, the doctors realized her symptoms did not match any known diseases or typical drug reactions. Efforts continued, but her condition rapidly deteriorated. Gloria experienced complete respiratory failure and a severe drop in blood pressure, forcing the resuscitation team to begin CPR, even as some staff remained unconscious or fainting. Despite the medical team's relentless efforts, Gloria's condition did not stabilize. Her body showed an extreme and abnormal reaction to medications and the environment, and every resuscitation attempt seemed to intensify the toxic symptoms and weaken the staff. After several intense minutes, the doctors declared her death. Gloria Ramirez passed away in the emergency room that same day. Following her death, the hospital launched an extensive investigation. It was hypothesized that the presence of certain chemical compounds in her blood may have caused the emergency staff's poisoning. This incident later became known as the case of the Toxic Lady. Wrong prescription. On December 24th, 1994, Betsy Lehman, a 39-year-old woman and renowned reporter for the Boston Globe, died in one of America's most prestigious cancer hospitals after weeks of enduring severe pain and drug toxicity. The incident began when she started a new round of breast cancer chemotherapy at the Dana-Farber Cancer Institute. On the first day of treatment, the drug cyclophosphamide was prepared for her as per the doctor's orders. However, no one knew a fatal error had occurred in the prescription. The dosage administered was 4 times the intended amount. This mistake entered the treatment plan without a second physician's review, without a pharmacist's verification, and without a final double check. Betsy was receiving a drug that, instead of fighting her cancer, was destroying her body. In the following days, Betsy experienced unusually severe weakness, nausea, chest pain, and overwhelming fatigue. She told the nurses, "I feel like my body is shutting down." But the medical team interpreted her condition as common side effects of chemotherapy. No one even considered that the drug dosage could be at such an impossibly high level. By the second week of treatment, her condition visibly deteriorated. Her immune system was nearly wiped out. Painful sores developed in her mouth and throat. Her body couldn't fight off the slightest infection, and high fevers weakened her further each night. During this time, Betsy spent most of her time lying in bed, breathing through the pain, still unaware that the cause was drug poisoning. Subsequently, her lungs began to fail. Breathing became more difficult, and she repeatedly needed an oxygen mask. Her kidneys also gradually began showing signs of failure. In the third week, her condition suddenly became critical. A severe drop in blood pressure, major cardiac issues, and persistent shortness of breath led to her rapid transfer to the ICU. On December 24th, 1994, while connected to life support in the ICU, Betsy Lehman died from multi-organ failure caused by severe drug toxicity. Blood group. On February 7, 2003, Jessica Santillán, a 17-year-old girl from Mexico who was being treated at Duke University Medical Center for a severe cardiopulmonary illness, was taken to the operating room for a combined heart and lung transplant. Her family had spent years searching for a suitable donor, and doctors had stated this transplant was her only chance of survival. The surgery began around noon that day and lasted several hours. By the end of the procedure, the donor's heart and lungs had been transplanted into Jessica's body, and she was transferred to the intensive care unit. A few hours after the surgery, later that evening, the transplant immunology lab contacted the surgical team with shocking news. The blood type of the transplanted organs did not match Jessica's blood type. Jessica had blood type O, but the new heart and lungs had come from a donor with blood type A. This was an extremely serious problem because her immune system would immediately begin attacking the new organs. Between February 8th and 10th, doctors tried to prevent organ rejection with powerful immunosuppressive drugs and full respiratory support. However, the signs of severe rejection grew stronger by the hour. The transplanted heart was functioning poorly, and the lungs were struggling with oxygen exchange. During this time, Jessica remained continuously in the ICU, dependent on advanced life support machines. By February 10th, her condition became critical. Her blood pressure became unstable, her heart function declined, and doctors were forced to use an ECMO machine to maintain blood flow and oxygenation. This situation indicated that the transplanted organs were being effectively rejected by her body. The hospital immediately began a search for new compatible organs. After several days on February 19th, news arrived that a suitable heart and lungs with a compatible blood type had been found. The medical team decided to attempt a second transplant as a final effort. On the morning of February 20th, around 6 a.m., Jessica was taken into the operating room for the second surgery. Doctors removed the initial organs and transplanted the new heart and lungs. The procedure concluded around 10 a.m., and Jessica was transferred back to the ICU. In the initial hours, the function of the new organs seemed relatively stable, and doctors held hope that she might survive this time. However, during the night of February 20th to 21st, her neurological symptoms suddenly began to worsen. Jessica was not responding normally to neurological stimuli. A CT scan of her brain performed at 3 a.m. revealed severe brain swelling and extensive bleeding. By approximately 9 a.m. on February 21st, a full neurological examination confirmed that Jessica had suffered brain death, suffocation. On October 12, 2006, Kyle Flack, a man approximately 20 years old with severe physical disabilities including cerebral palsy, blindness, and deafness, was a patient at Basildon University Hospital in England. Kyle required constant nursing care for all his movements and daily needs and was supposed to be under supervision throughout the night. During the night, Kyle was in a sleeping and resting state. The bed rails were designed to prevent patients with severe disabilities from falling out. However, in practice, the gap between the rails and Kyle's physical positioning caused his head and neck to become trapped between them. Kyle, who lacked the ability to move independently, could not free himself and began making limited attempts to move, but his physical condition prevented him from escaping the dangerous position. The nurses on that shift were responsible for checking on severely disabled patients every few hours, but due to flaws in the monitoring systems and a high number of patients, the crucial time to attend to Kyle was missed. By the time the nurses noticed his situation, clear signs of suffocation were present, and Kyle had suffered from oxygen deprivation. Immediate efforts to free him began. The nurses tried to open the rails and called for assistance from other staff, but the lost time meant his condition was already critical. He was quickly transferred to the intensive care unit, and emergency medical procedures, including oxygenation and cardiac and respiratory support, were performed. Despite all efforts, his condition did not improve, and Kyle passed away. Dog attack. On May 24, 2008, Padmanabhan Sahu, a 55-year-old man, was transferred to a government hospital for intensive care and recovery after sustaining severe injuries from a bear attack. He lay in bed, extremely weak and completely unable to move, requiring close monitoring due to his critical condition. As night fell, due to the neglect and carelessness of the hospital staff and a severe failure to maintain safety and hygiene, no one was present around him, and the ward doors were left open. Meanwhile, 2 stray dogs that had been roaming the hospital grounds seized the opportunity and entered the treatment area. The dogs approached Sahu's bed. In the silence of the night, they viciously attacked Sahu, who was utterly defenseless. They began mauling his face, severely damaging his eyelids, ears, and parts of his nose. The horrific attack continued until a staff member, alerted by Sahu's faint moans and the sound of the dogs barking, discovered the incident. The staff immediately intervened and drove the dogs away, but the inflicted damage was irreversible. The secondary injuries from the dog attack were added to his pre-existing trauma. Despite medical efforts to stabilize Sahu's condition, the new injuries and the shock to his body were more than he could withstand, and he passed away following this horrific attack. If you'd like to see more stories like this, make sure to follow the channel and share your suggestions for future videos in the comments section.